And researchers in Britain have made a very welcome discovery in the fight against COVID. A low-cost, widely used anti-inflammatory has improved the chances of survival for seriously ill patients. Now, this is the first treatment so far to show life-saving promise. The medicine dexamethasone has reduced deaths by a full third among patients on ventilators. The drug, though, does not bring any relief to patients with milder symptoms.
Hospital staff are struggling to help severely ill COVID-19 patients in the UK. Though these images were recorded several weeks ago, scenes like these are still being played out around the world. Every day brings more deaths. But now a glimmer of hope. The worst-hit country in Europe is hailing a major breakthrough. Scientists at Oxford University say they have identified the first drug that can save the lives of COVID-19 patients. Dexamethasone is a widely used steroid. A randomised trial showed it reduced death rates by a third in patients on ventilators and by a fifth in patients receiving oxygen.
It really is showing quite a significant effect. And it's really important because the drug itself is very widely available. It's on almost every pharmacy shelf in every hospital. It's available throughout the world and it's extremely cheap. So we've looked at the numbers, and if we treat 8 patients in intensive care with this drug, we'll save 1 life. And the total cost of treating all 8 patients is only about £40.
£40 is about $50 US. The drug works by reducing inflammation in the lungs. The study results are still to be peer-reviewed, but the UK lost no time in approving it for use in the country's health service.
We've been stockpiling it since March, so we now have 200,000 courses that are ready to go, and we're working with the NHS so that the NHS standard treatment for COVID-19 will include dexamethasone from this afternoon.
As a generic drug, dexamethasone is readily available around the world. It's not a cure for COVID-19, but with no vaccine yet available and infection rates rising in many parts of the world, its potential is welcome news.
So what exactly do we know about dexamethasone and how the steroid combats COVID-19? Well, we put that question to Jason Kindrachuk. He's a professor in virology at Canada's University of Manitoba.
So one of the things that we tend to look at with these different types of emerging viruses is the fact that they tend to basically increase the immune response. So we essentially get an overstimulation of the immune response, which in most cases actually is protective for us, but in many cases can actually increase disease severity. So the hope with something like dexamethasone is that rather than acting directly on the virus and trying to reduce the ability of the virus to create more copies of itself, what the drugs are trying to do is essentially reduce all that damage that is part and parcel of an overactive immune system. We're trying to learn about this in real time, and we know that some of the initial data that had come out at the very start of this pandemic had suggested that steroids actually may exacerbate disease in those that are in the early stages. So I think one of the concerns right now with dexamethasone is that would there be the potential that if you treated patients too early, that you might actually end up increasing the potential severity of disease because it actually acts as an anti-inflammatory. So I think that we have to look at this as a potential game changer for those patients that are actually in severe disease distress, but we are still lacking for some sort of a therapeutic that will ultimately help reduce infections in the very early stages of disease.